Good morning, Connecticut. Thanks for joining me to learn a little bit more about Kybella, the FDA-approved treatment targeted at destroying moderate to severe submental fullness to improve your profile. Using the letters of Kybella as an acronym will help you remember the important details of this treatment. So K stands for kills fat cells. Kybella permanently eliminates submental fullness through its ability to emulsify. Y stands for years younger appearance. And submental fullness is an undertreated condition that can detract from an otherwise balanced face and neck. Excess submental fullness affects adults, both men and women, of all ages and weights, and leads to an older, heavier look. So B stands for busting myths. There's a lot of false information that I've heard out there that I'd like to put to rest. Unfortunately, there are no number of exercises that will help tighten the submental region. Chewing gum or pouting your lips will also not help. Tightening your upper face and forehead unfortunately will not pull the skin underneath your chin tighter and decrease that pocket either. E stands for effects. So let's talk about the most common risks and side effects after having a Kybella treatment. Swelling and bruising are the most common and typically resolve within 1 to 2 weeks after treatment. Other less common potential side effects include nerve injury in the area of the jaw, which in clinical trials had an incidence of 4%, and all resolved without treatment on an average of 6 weeks. Temporary trouble swallowing, skin irritation, and alopecia in the treatment area were also uncommonly found. All of the side effects that I just mentioned are temporary, and in our office we most commonly see swelling and bruising as the most common side effects, but people still typically return to work within 1 to 2 days after treatment. L stands for length of treatment. So your appointment will typically be scheduled for about 30 minutes, and that gives enough time to include completing pre-procedure paperwork, reviewing the treatment timeline, and the time to mark out the area with the template, which is right here. The actual injection of Kybella only takes about a minute, so just remember, a minute in the chair to be a little bit more square. The second L stands for lift, and as Kybella works, an inflammatory response occurs which causes the area to swell for about a few days and also causes the local tissue to tighten, giving your submental region a lifted appearance. While Kybella is not primarily indicated for skin tightening, we have seen good skin tightening results in our patients. And A stands for after treatment expectations. After completing the appropriate number of Kybella treatment sessions for your area of fullness, you can expect to see a decrease in fatty deposits and therefore a more chiseled jawline. Treatments vary based on the number of vials of Kybella that are used, as well as the number of treatment sessions for your submental area of fullness. And again, we use the template to determine how large of an area to treat. And typically patients may start to see changes as early as a few weeks after treatment, but the body will continue to naturally process the injured fat cells and rid them from your body for approximately 2 months after the injection. Kybella treatments are done in a series, and injections will be given at least 2 months apart. And we often find that patients progress through treatments, as they progress through treatments, they require less deoxycholic acid since there are less fat cells present. So hopefully you found this helpful, and if you have any additional questions or if you're wondering if you're a good candidate for this treatment, please don't hesitate to reach out to me or any of the staff here at Jandali Plastic Surgery.